Hello and welcome to a special edition of Health and Wellness Save a Life. I'm Gargi Rawat. According to the World Health Organization census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. The concerning change in recent times is that the onset of heart disease is now seen at a younger age, especially in people who are in their 30s and 40s. The biggest reason for heart-related deaths is a lack of awareness as to what needs to be done in a cardiac emergency. Every adult should know which conditions qualify as heart-related or medical emergencies. The best one can do is to learn beforehand the actions required in a case of cardiac emergencies, and life-saving techniques such as CPR give you the power to save a life. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Anoop Gopinath, Head of Department of Interventional Cardiology, Rajiv Gandhi Cooperative Hospital, Palakkad, Kerala, Dr. K. Kunhali, Program Director and Senior Consultant Cardiologist, Malabar Hospital, Dr. Yogesh Kothari, Head of Department Cardiac Sciences, Senior Interventional Cardiologist, Bhagwan Mahavir Jain Hospital, Bengaluru. Thank you so much, doctors, for joining us on the show and sparing your time. Dr. Gopinath, first I'd like to ask you about, how heart disease is a general term that includes many types of heart problems. Heart valve disease is one of them. How common is heart valve disease and what are the types of heart valve disease?
Now, valvular heart disease is a very common condition in India. The reason is because there is a higher prevalence of rheumatic fever in India when compared to the other places in the world. The prevalence is, if you see 1,000 patients, maybe one person can have a valvular heart disease. Now, there are different types of valvular heart diseases. A condition, sometimes there is narrowing of the valve, which is called as valvular stenosis. Sometimes the valve becomes leaky. This is called as valvular regurgitation. If the narrowing of the valve or the leaky valve occurs right from birth, it is called as a congenital valvular heart disease. If it occurs after acquiring an infection in childhood, it is called as a rheumatic heart disease, which is a very common type of heart disease, a valvular heart disease in India. And the third is a degenerative heart disease, which is associated with lifestyle changes like diabetes, hypertension, high lipid levels, etc., which can cause calcification of the valve leaflets, which in turn causes narrowing of the valve or a leaky valve. In urban cities in India, the degenerative valve diseases are on the rise. So the three main types of valve diseases, you have congenital valve disease, rheumatic, or a degenerative valve disease.
All right, Dr. Kunhali, the more you know about risk factors, the more cautious you can be and the better you will be able to prevent the condition. What are the risk factors associated with heart valve disease and can we prevent it?
Human heart has 4 valves and any one of the valves can be affected. And there are a number of risk factors for valve disease. One is age and gender. Men over 65 and women over 75 are at a greater risk of acquired valvular disease. Second one is family history. Some valve problems may run in families. One example is bicuspid aortic valve disease. Then the third one is health history or the past history. Certain infections may lead to rheumatic fever in childhood, the heart failure, kidney disease, hypertension, or metabolic disorders can also increase the risk of heart valve disease. Hypertension, as you know, initially increases thickness of the heart muscle, then there is dilatation of the left ventricle, and this can also lead to valvular heart disease. Autoimmune disease like lupus erythematosus can inflame the valve and it can result in valvular regurgitation. Chemotherapy or the radiation for cancer can damage the heart valves. And certain diet medications can also affect the valve, and once you stop those drugs, it may reverse. The next important cause is the infection. Infection may be direct infection, or it's an infection elsewhere which is responsible. For example, rheumatic fever has already been mentioned here. Patients who develop streptococcal sore throat or scarlet fever, later on, due to the autoimmune mechanism, their heart valves are damaged. Certain types of heart diseases, for example, myocardial infarction or cardiomyopathy, also can affect the functioning of the heart valve. Certain metabolic disorders like Fabry's disease, familial hypercholesterolemia, and parathyroid disorders can also damage the heart valve. The second half of the question is prevention of the valvular disease. As we know, the rheumatic fever is the most common one, and rheumatic fever can be prevented by prompt treatment of streptococcal sore throat and the scarlet fever. And also then recurrence of this rheumatic fever can be prevented by antibiotic prophylaxis by giving penicillin once in 3 weeks as a long acting injection or twice a day as tablets. Then infective endocarditis, direct infection of the heart valve, can be prevented by prompt treatment of infections, and also they can be prevented by treating with antibiotics all those patients who are undergoing minor or major surgery or a dental extraction or a dental workup, or those who have any infections. And prompt treatment of hypertension, diabetes, and dyslipidemia also can prevent further damage to the heart valve. These are the preventive measures for heart valve disease.
Right. Dr. Kothari, can we recognize the symptoms of heart valve disease early, and what are these symptoms of the heart valve disease?
Very important question. So basically, depends on whether it is stenosis or regurgitation, as Dr. Anoop has already pointed out. So patients who have valve stenosis, they generally tend to have tiredness, they tend to have breathing difficulty, and patients who have regurgitation tend to have more palpitations, when they do an exertion, they start feeling their heartbeat. They will have a lot of effort tolerance. Effort intolerance is the most important symptoms of valve disease. The activities which they are normally doing, they are unable to do those activities. This is a very, very important symptom in general of heart disease and valve disease in particular. And these are important pointers for early detection of valve disease.
Right. Dr. Gopinath, how is heart valve disease diagnosed, and which method would most easily identify a heart valve abnormality?
Okay, so when a person has a valvular heart disease, there will be difficulty in breathing during his routine activities. If he has a difficulty in breathing while lying down in bed at night, and there is some amount of irregular palpitation that comes and goes, if you have severe dizziness, tiredness, chest pain, and you see that both your legs are swollen, it's time for you to go to a doctor. And if the doctor detects a murmur, it's time that he refers him to a cardiologist who will see the gold standard investigation, which is called as the echo. An echocardiogram is done, which will help us to detect whether there is a valvular disease or not, whether there is narrowing of the valve or leaking of the valve. And if there is narrowing or leaking, what is the severity of the disease, and what is the treatment that is to be adopted by him? Whether he should continue medically, or whether he should go for a surgical intervention. So echocardiogram is the gold standard for the diagnosis of valvular heart disease, supplemented with an ECG and a chest X-ray.
All right, Dr. Kunhali, what is treatment for heart valve disease? Can a heart valve be fixed without having a surgery?
And the heart valve disease treatment depends upon the severity of the disease. If the patient has only mild or moderate heart problems, he may not require any surgery. He may be managed by medical treatment and especially symptomatic treatment. But when they have severe heart disease, severe valvular disease, either stenosis or regurgitation. For stenosis, especially the mitral valve stenosis, what we used to do earlier when it is severe was closed mitral valvotomy. That is a minimal surgical intervention. That is, you do an incision in the left chest and open the chest minimally and go into the chest cavity, get into the left ventricle and open up the mitral valve. That was a closed mitral valvotomy. Then came the open mitral valvotomy, where you do the open heart surgery, look at the mitral valve and open up the stenosis. Then we had the balloon mitral valvotomy. That is, a balloon is passed through a catheter from the vein and you go into the right atrium, then you puncture the intraatrial septum, get into the left atrium and position the balloon in the mitral valve and inflate the balloon, and that would open the stenosed mitral valve. And there was the single balloon technique and subsequently the double balloon technique. All these used to open up the mitral valve. And for mitral regurgitation or any regurgitation, if it is severe enough, one has to replace the valve. So the replacement of valve was earlier by open heart surgery, and it's a major surgical procedure. And patients who are very old or they have comorbid conditions or they're sick and they're not eligible for open mitral or open valve replacement, such patients are now being managed by transcatheter aortic valve replacement. That is the TAVR. That is a minimally invasive, or it's some people can call it non-surgical replacement of the valve. You go through the femoral artery and pass a catheter with the balloon, take it to the aortic position, place it there and fix it there. This is relatively less invasive aortic valve replacement or aortic valve surgery, and now we have more than 30 centers in India successfully doing TAVR, and this is how surgically it is managed. Some valve diseases you can repair them and not replacing, and that is also possible.
All right. Dr. Kothari, how serious is a heart valve problem and can this then cause sudden cardiac death?
Heart valve disease comes with various severity. Initially, so it depends on the screening. If they are screened early, then you can follow up these patients for a much longer time when they are mild and the symptoms can be managed with medications. As the condition progresses with our advancing age, it becomes more and more severe. So it's basically a very progressive disease because heart valves are all mechanical structure and there is a lot of wear and tear as heart functions on an everyday basis. So when it progresses, the valve condition becomes more and more severe, and then their symptoms start as we had already discussed. And once these symptoms start, then they need to be managed either by catheter, which is non-surgical, or by a surgery. Regarding the second part of the question, that is the risk of sudden cardiac arrest. Yes, sudden cardiac arrest is a very, very important outcome in some of the valvular heart disease, especially the valves involved like the aortic valve. When you have a severe aortic stenosis, such patients can develop what we call as a sudden cardiac arrest, and they can happen at any time during the course of the disease. So it is very important to be aware that patients with valvular heart disease also can develop sudden cardiac arrest, like just like a heart attack patient can develop a sudden cardiac arrest. Valvular heart disease patients also can develop sudden cardiac arrest, and we need to be aware of that. Sudden cardiac arrest is there in about 2% of valvular heart disease aortic stenosis per year. If the patient has any loss of consciousness and if they have valvular heart disease, they should get themselves evaluated for the risk of sudden cardiac death, because sudden cardiac death is better prevented than treated when they develop a problem. So the ways to assess risk of sudden cardiac death is using what is called as a long-term rhythm monitoring with devices like Holters, loop recorders, and sometimes we do what is called as an electrophysiological study. If the valve disease is already severe, then these tests may not be required, and you may directly go ahead and replace the valve either surgically or transcatheter, depending on the patient and depending on the valve involved.
All right. Well, with that, we'll slip into a short break, but don't go anywhere. We have a lot more questions for our panel of doctors. Stay with us. Welcome back. You're watching Health and Wellness. Well, let's go across to our doctors to find out more about heart health and valve disease. Dr. Gopinath, what is the first thing you should do if someone goes into a sudden cardiac arrest?
So, when a person develops a cardiac arrest, the immediate thing that is to be started is a cardiopulmonary resuscitation, also called as a CPR. When the cardiac arrest occurs, the blood flow from the heart stops to the vital organs.
Dr. Kunhali, lack of CPR awareness is a huge challenge in India. Tell our viewers about what are the main steps of CPR.
If CPR can be performed out of hospital on site, you can save many, many lives. And we should have a national program for training every adult individual in the CPR so that more and more lives can be saved. And if you see a person who is not responding and whom you think has gone into a cardiac arrest, first thing you do is check the scene for safety and use a PPE kit if you have one. And next is confirm the cardiac arrest. Feel the pulse, and if you know how to feel the carotid, but it is better to feel the carotid pulse. And if the pulse is not felt, and if you have got a stethoscope, you auscultate and look for the heart sound. If pulse is not felt and the heartbeats are not heard, that's an indication that the heart has stopped. Next, you look at the breathing. Put your hand or palm over his abdomen and then see whether it is moving. And then if there is no movement, that's an indication that he has stopped breathing. Once you have confirmed this cardiac arrest, the next thing you look at the surroundings to see that whether there has been a life-threatening bleeding or any other serious condition. Once this has been done, if the person is not responding, you start the cardiopulmonary resuscitation. Before that, call for an ambulance. And if you have somebody else with you, ask him to do that and you straight away start the CPR. Place the person on his back on a flat, firm surface. Give 30 chest compressions using both hands together and kneeling down beside him. And each compression, it should be at least 2 inches, you should go down and then permit him to recover. And so after 30 compressions, you give the breathing. After 30 compressions, 2 breaths. And allow, after the first breathing, first breath that you have given to him, allow the chest to recover.
Right.
And if you find that there is no expansion of the chest, then you look at the airway and clear the airway and give him the breathing. So after every 30 chest compressions, you give 2 breaths. And once the rate of compressions is 100 to 120 per minute. And once you have gone on this, if you have 2 people around, you can alternate between the artificial breathing and also the chest compressions. And if the automatic electrical defibrillator AED arrives, then you start using the defibrillation and you connect put the parallel on his chest and look at the rhythm of the heart and give him the electric shock and revive him. And if the
Right.
ambulance has brought in ambu bag, you can use that for the breathing.
All right, Dr. Kothari, what if a person has an ICD or a pacemaker and then they have a cardiac arrest? So can we perform CPR on such patients?
Yeah, you can certainly.
Yeah, very, very important. Patients, a lot of patients have nowadays implanted devices, what we call as cardiac implantable electrical devices. So these electrical devices include pacemakers and ICDs. Pacemakers are devices which take care of the slow rhythm. So pacemakers do not take care of cardiac arrest by themselves because cardiac arrest happens because of a very, very rapid chaotic rhythm in the heart which causes cardiac arrest, which is called as ventricular fibrillation. And this cannot be treated by the pacemaker. Hence, a pacemaker patient has to be given CPR. And usually in a lay people, it has to be a simple CPR where you do a hands-only CPR, as Dr. Kunal has already told in great detail. Just do the hands-only CPR 100 to 120 times per minute and then keep assessing the patient. In a patient who has an intracardiac defibrillator, the intracardiac defibrillator, if functioning properly, is capable of treating the cardiac arrest by itself. It is slightly much more superior to what we use an AED, external electrical defibrillator. Internal electrical defibrillator is much more sensitive and much more accurate in treating cardiac arrest. And generally, a requirement of CPR may not be required if the patient has an ICD, because ICD itself is able to take care of cardiac arrest, whether it is because of a slow heartbeat or a fast heartbeat or a ventricular fibrillation. All of these rhythms can be taken care of the ICDs. But sometimes ICDs can fail, and in that situation, the CPR can be given safely. So, a cardiac device or a cardiac valve implantation in the patient is not a contraindication for giving CPR in the situation of a cardiac arrest.
All right. Well, thank you. We're completely out of time. Thank you so much, doctors, for joining us and taking out your time and answering all our questions regarding heart health. Thank you all for watching at home. Goodbye.